Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Cokerhook. And this evening, we're going to be talking about an area of the healthcare industry that's actually beginning to get some momentum here in the United States. And it's actually called medical tourism. And what that is, it's the action of people from the U.S. going outside of country to get specific medical services. And it's quite a growing industry, I've come to find out. And with me this evening to talk about this is Kiki Bright. Kiki, welcome to Reference Point. Pleasure to have you here.
Oh, it's my pleasure to be here.
And you have a company called Thai Medical Travel Tourism, right?
Yes.
Okay. Well, I really want to talk about this whole concept of medical tourism because it's a very fascinating thing for me. It was an area that I just sort of stumbled on some information about a couple years ago. So tell us a little bit about this concept of medical tourism and why it seems to be taking root here in the United States.
Well, basically for medical tourism is not something new, but the term medical tourism is new because the industry is booming. So what it means is it is where people traveling from one country to the other country to receive medical or surgical or dental treatment.
Okay.
At the same time receiving an equal or the higher quality of care with the cost-saving benefit or the excess of care which is not available in their home country.
And this is not just something that folks in the U.S. do, but this is a global phenomenon,
Yes,
isn't it?
Right, exactly. Like in Thailand, for example, we have about 2 million international travelers and medical travelers per year.
Really?
In
2
Thailand.
million people go to Thailand for some
Right.
type of medical service. That's
Right.
amazing.
All over the world, they travel to Thailand because of the high quality of care.
Now, Thailand isn't the only country that offers services like this, is that correct?
Yes, well, I mean, no. So what I mean is there are many countries in the world who try to establish their medical tourism and they try to target the U.S. market.
Ah.
But there are 4 countries in the world that are predicted to generate 8.5 billion in the next 4 or 5 years.
8.5 billion?
Right. Those countries are Thailand, South Korea, Singapore, and India.
In India, okay.
Right.
So what is, well, you already answered that. I was curious about some of the popular destinations, and you mentioned that for me. But why Thailand? What makes Thailand one of the premier locations that people look to go to for this type of service?
Well, first of all, you need to understand that what are the factors that make one country to become a great medical tourism destination. Some factors are, the low cost of production, which results in the low cost of the healthcare, and also the country infrastructure and people and hospitality, tourism, medical professionals, domestic research and development, and the medical technologies. So Thailand have a great combination of those factors to make it a great medical tourism destination. But what is unique about Thailand is it makes Thailand so different than other destinations. I think you probably heard about Thai people, right? And Thai people, they have a well-deserved reputation of having a compassionate and a warm, hospitable nature. So that shows not only in the daily life, but also in the tourism and the medical industries.
That's an interesting point because one of the things that, having had to use medical services here in the States myself in the past, one of the things that is you look for when you're not feeling well, you're looking for someone that's going to help you or service you in a hospital setting that is at least make it look like they really are caring, they care about what's going on.
Right.
And it can be hard sometimes here in the U.S. The U.S. infrastructure for medical care has a lot of pressure on it from a financial perspective and other perspectives. So it's not always as relaxing as you might need it to be as a patient. I think another thing I want to ask you about, something I want to go to in just a minute. We actually have a videotape that you told me about that we're going to show to people. But before we get to that, I wanted to ask about the kinds of services, because when we're talking about why people would travel outside of their home country in order to get services, what kind of services are we talking about? Is it just, you know, I mean, what do you go for?
What kind of procedures,
yes.
you mean? Well, in Thailand, we are very well known for the heart and vascular-related diseases, and also musculoskeletal and spinal degenerated diseases. And they also have orthopedic surgery, and of course plastic surgery is a big part of that, and also the stem cell and regenerative medicine.
Oh really?
Yes.
Stem cell research.
Yes.
They do a lot of that in Thailand, huh?
They do a lot of that. We actually work with you know, field specialists in that area.
That's fantastic, because we have sort of a limited scope of things that we're doing here in the U.S. based on.
Right.
We won't go there. We don't want to. We're not here to talk politics. We're here to talk medical treatment. So I want to actually go to this videotape now. It's only about a 4-minute or 4.5-minute video, but it's real interesting, and it talks about Thailand medical tourism, and I wanted to kind of incorporate that into the thing. So if we're ready for that, let's take a look.
In recent years, 1.4 million international patients have received medical treatment in Thailand, and the number is increasing every year. What has made Thailand become such a popular destination for medical tourism? What has made people from around the world put their trust in Thailand healthcare? If you ask patients who have had healthcare experiences in Thailand, they will tell you the same reasons for making their decisions, which can be summarized in these 6 reasons to make Thailand your medical tourism destination. Thailand features 13 hospitals accredited by JCI, Joint Commission International, which according to JCI gives such hospitals access to a variety of resources and services that connects them with the international community. An international quality measurement system for benchmarking, risk reduction strategies and best practices, tactics to reduce adverse events, and the annual executive briefing programs. In addition to Thailand's modern medical facilities and a strict adherence to international medical standards, Thailand's surgeons, doctors and nurses have been meticulously trained to the highest levels, with many specialists conducting research and gaining experience at the world's best medical institutes. In fact, there are almost 500 Thai doctors practicing in Thai hospitals that are American board certified. These medical professionals are therefore trained in the latest techniques and are skilled at providing the highest quality medical treatment. The cost of medical treatments in Thailand is significantly lower compared to identical treatments in the developed world. In fact, treatments in Thailand are typically far less expensive than elsewhere in the world. One of the great advantages of receiving medical treatment in Thailand is the ease with which appointments for treatments can be arranged. Thailand hospitals have numerous operating theatres and enough qualified surgeons that there is little, if any, waiting for scheduling, even with the most complex and invasive procedures. Aside from their expertise and access to the latest technology, Thai nurses, doctors, surgeons and therapists never forget the most fundamental element in a complete treatment and swift recovery. Namely, a warm and caring human touch. Friendly and truly considerate to the needs of all their patients, local nurses and doctors will make you feel relaxed and confident in the treatments you have selected, ensuring all your needs are met. A proud part of the national character, Thais have a well-deserved reputation for their compassionate nature and warm hospitality, which is why the country is nicknamed the Land of Smiles. You'll be so at ease that you'll think you are a guest on holiday from the moment you arrive at the hospital. All of Thailand's leading hospitals feature cutting-edge technology that helps them provide the highest degree of medical treatment and service.
Very interesting video. But one of the things about that I wonder and have to ask you about it, when you look at that type of a thing, you know, you go to a foreign country to have some services done, whatever, it kind of looks like something for the rich and famous. But is it really affordable for the average person, you know, middle-class American who maybe needs a knee replacement or something like that? Is it really that affordable for them to be able to go and do something like that?
Yes, it used to be for the rich and famous, I have to say that, you know, because of the high quality of care and the attentiveness of the medical professionals to the patients. And right now, you know, a lot of people go there for that reason as well, more than the price. But, you know, talking about medical tourism, you know, it's unavoidable to talk about the cost-saving benefit. And Thailand is a very cost-effective country as far as the medical procedures. And the patients can expect to save up to 80% of the cost. Like the knee replacement, it would cost about $50,000 here.
Yeah, I think we have a little graphic on this that you shared with me. And you know, if a knee replacement surgery in the U.S. costs about $50,000, it's substantially less in a country like Thailand. And
Thailand would be about $10,000 to $12,000, depending on
for the procedure.
Yes, depending on where you go, you know. And then if you add the hotels and transportation and meals and all of that, it should not be more than $15,000, which is still 70% lower than what you have to pay in the U.S.
So you can go on to a place like this, and even though you've got the travel costs, it's still a much better type of a situation. So how would the treatment and recovery experience differ if you're from a medical tourism perspective, if you're going to some place like the countries you mentioned, South Korea, Singapore, Thailand, versus here in the States?
Well, probably you already know about the U.S., you know. There are so many restrictions and a lot of financial limitations to the healthcare here. But in Thailand, we don't have that problem. I mean, for the healthcare itself, because the profit that the hospital makes, it would go directly to the patient's benefits, such as they would buy, you know, more technology, medical equipment, and they would hire more people, more medical staff. So, for example, the moment that you arrive at the hospital, somebody would come and then open the door for you and greet you and walk you to the door, and then the next person would open the hospital door for you. You go inside,
and
then
you feel like you're getting a
and
treatment.
Someone else come and then greet you and, you know, find out what your needs and wants are, and then you will have a chance to talk with doctor and so on.
You had sent me something that I took a look at earlier, Kiki, that talked about the kind of patient-staff ratios, the doctors to the patients or the nursing staff to the patients. And that was kind of stunning to me because I don't think we see that so much here in the States. Talk a little bit about that.
Yes, in Thailand, like I said, they hire a lot of medical professionals. You know, they have a lot of RNs. So if you are admitted in one in the national patient ward for some kind of treatment, in one floor they would have more than 5 or 8 RNs, and then the ratio of the nurse to the patient would be as low as 1:1.
Wow,
and
1:1.
Yes, and then for the doctor to the patient would be 1:4.
Wow, that's still pretty incredible because you don't get that kind of that implies a much higher level of interpersonal reaction between the healthcare provider and the patient.
Yes.
And so now, how long have you been involved in this medical tourism process?
I have started this since year 2000 when I was living in Thailand. And then I stopped doing that for a while. And in 2008, I just have my company incorporated in the U.S.
Okay, so you've been doing this for a while, and I
Yes.
guess you've been seeing some growth, obviously, in
Yes.
this activity.
Yes.
So, if some of the things that I suspect that the average person is going to ask and think about is the things that came to mind to me when I first heard about this. Like, well, gee, if I'm going to go someplace else, I mean, the reputation for American healthcare in terms of the quality of the care is very, very high. And so the question is, if I'm going to some other country to have open heart surgery or a hip replacement or something like that, what am I going to experience? Am I going to be able to avail myself of a similar quality of care?
Yes, of course. When medical travelers travel to international destination like Thailand, they would look for the same standard of the facility. And there is one organization in the U.S. Which is called JCI, Joint Commission International.
Okay.
That's what it stands for. And they accredit about 425 hospitals and clinics in the U.S. And then outside the U.S., they accredit about 125 hospitals.
Okay.
And in Thailand, we have 13 JCI accredited hospitals. So they have the same or higher standard than the U.S.
So that's the agency that, well, that makes sense. And so what you got is you've got some third party saying the level of service, the quality of care is at least comparable. And if I'm not mistaken, weren't a lot of the doctors actually trained in the United States initially?
Yes, many of them, well, the majority of the doctors actually are trained in the United States, Europe, and Australia.
Oh, okay.
And in fact, we have more than 500 Thai doctors who are U.S. board certified.
Oh, wow.
Yes.
Okay. Well, that's pretty cool. So what that communicates is to somebody like myself who's thinking, that it's not like you're going to a third world country where they're going to be, somebody's going to use a wood saw to cut into you and stuff like that. You've got the services are high quality, and when we looked at the video, there was some information there about the level of technology too, because you were mentioning that there's a high level of investment in the equipment and things like that.
Right. So it used to be the due to exemption for the medical equipment between 1980 to 1990s, and then later on we have a lot of medical technologies in Thailand, and at one point actually Thailand has more CT scanners than in Bangkok alone, more than the entire UK.
Oh, really?
Yes.
More CT scanners in Bangkok than in the entirety of the UK? Wow. Wow, that's pretty incredible. So let's look at this from another perspective. So here I am, I'm an American, and I'm thinking about this possibility. But here in the States, if I'm going to have some of these necessary or even elective surgeries done, I have my medical insurance coverage that I can rely on for some of that. Do you lose that possibility if you're going overseas for services?
It just depends on what policies you have. So a lot of companies right now in the U.S., they try to cover medical tourism as the cost-saving approach. And then they have something which is called self-funded insurance.
Okay.
So they try to build that in for employers to save money, and by including the medical tourism destinations.
So it's a possibility, depending upon what plan that the company you work for has, that they might actually embrace that.
Yes.
Which is really very interesting and quite surprising to me, and I think quite cool, because I can see. I know people who have gone places. I know folks who travel down to Mexico to get some dental work done and that sort of thing, because the cost here in the States was so much higher than what they were going to get down there, and they did whatever research they did, and they felt comfortable with it. But they weren't able to cover it. It all came out of pocket. But if the industry is maturing to the point where there is the possibility that you can get some of the procedures covered in an insurance thing, that makes this kind of cost-benefit thing even more pronounced, doesn't it?
Yes, exactly, because they would pay lower than what they pay here, I mean, for the insurance companies. So why wouldn't they want to do that?
Well, very interesting. So how do people come to learn about this sort of thing? I mean, the whole concept here was very new to me. Hopefully, some of the viewers are thinking, I wonder what that's really all about. How does one go about looking into this concept? I mean, where do you go to do a little research to figure out whether or not it's something that might be appropriate for your circumstances?
Well, if you have some needs, some medical needs, and medical travel, you can do research by going online. And if you want, I mean, if you want to look into that in the hospitals, you can check some information there. But then, if you would like to work with a company, like a facilitation company, the company can help you from start to finish. And then that would help you a lot in getting more information.
Okay, and I think the point with respect to that, folks, is that there's a lot to figure out and to understand about this concept. And so where do you begin? I'm going to suggest that if you have any thoughts or questions about something like this, send us an email here at info@referencepointtv.com, and we will get that question to the right party, Kiki or someone like Kiki, who might be able to answer the specifics about the concept or the question that you have. So that's a possibility, and hopefully that'll stimulate some thought for people, because
Yes.
it's real interesting. We had I had a guest on my show about a month or so ago who is a practicing physician here in the United States that's doing home visitation healthcare. So she goes to people's places of business or their homes if they have a condition that they call her up and she goes to them. That sort of thing hasn't happened for 50, 60 years in the United States. We haven't seen that sort of level of service. So the point of that is that there's a tremendous amount of change going on in the way that we as Americans are reaching out for our health care. We know we need stuff.
Right.
And it seems to me that this is just another possible alternative that could make sense for people in a variety of circumstances.
Yes, I would think so. I think especially, when we have the healthcare reform in year 2014, that we will see a growth of medical tourism, and right now we already seen it. Last year we had 6 million Americans traveling outside the country for that reason.
6 million Americans traveling outside of the country.
And it's actually 35% sustainable growth.
Really?
Yes.
So this is something that's going to keep on going. And you mentioned earlier, there's a whole array of services that can be offered. Dental, orthopedic, major surgery, cosmetic surgery. And the other thing that we haven't really spent too much time talking about is when you've had your procedures and the opportunity to recuperate in an environment that's much more relaxing potentially than what you might find at a, I mean, here in the States, you're in the hospital, and then when you get done, you go back to your house, and it's like, okay, I got all the pressures of my real world coming back in on me. But if you're going outside of country, there's a difference there, isn't there?
It's quite different, especially in Thailand. Who wouldn't want to go to Thailand, So, when you go there after your treatment, the beach is just, minutes away from your hospital. You can just, get in the car and then somebody drive you to the world-class beach resort, which is very reasonable price too. Or you can fly over to Phuket, you can go to Chiang Mai, and it's only 1 hour flight from Bangkok. And we have reputation of having beautiful hotels, and you can enjoy the world-renowned Thai cuisine.
Yep, of course.
And then sightseeing, go see hundreds of temples in Thailand.
Which is a completely different concept for recuperation than you might find in the normal expectation for something if you've had to have a surgical procedure, again, a knee replacement, a hip replacement, or something else like that.
Right.
I mean, just that concept in and of itself is so different. And it seems to me, from what we've already looked at, that it's actually affordable for a lot of people.
Yes.
I mean, it's not like so far out of reach that it doesn't make sense. If you're going to get a knee replacement surgery and you're going to end up spending 50 grand, even if your insurance company is going to cover, 80% of it, you're still spending a lot of money. You might as well, maybe, you could spend about the same amount and out of your pocket and go and have an experience that actually enhances the recuperative activity.
Yes.
Very cool.
Exactly.
Very cool. So what caused, what prompted you to bring the concept to start a company here in the U.S. as opposed to continuing your activities in Thailand?
Because I moved here to the U.S. I moved with my family here, so I think it would be easier for me to station here and then continue on from here. But that doesn't stop me to do a good job, because I already have experience in that area.
And you have a lot of connections in Thailand as well, which has got to be a facet of this from the standpoint of someone who's created a facilitation company. Having all those connections has got to be a real asset to you too.
It's very important.
Well, Kiki, we only have a couple minutes left in the show today. I want to first thank you for coming and being a guest on the show. I mean, this is a whole interesting topic and very fascinating, and I hope that the audience out there has gotten some information on it. I'm going to remind you folks, send in your queries at info@referencepointtv.com. But as we wrap up this discussion today, are there one or two or three things that you think that people should really hear about or think about if they're considering something like this?
If they consider something like this, one thing that they should keep in mind, when they go there, if they will work with a facilitation company, they should make sure that that company really understand the destination country and have all the service in place, because at the minute you are out of the hospital, yes, you still have the support from hospital, but then you need to have the support after that as well.
Makes a lot of sense. So you could, instead of trying to just do it all on your own, have somebody that can actually help you through that recuperation process and get around, because you may not be quite the condition to do it for yourself.
Right.
Kiki, I want to thank you so much for coming and joining us here on Reference Point. Fantastic information, fascinating subject, and ladies and gentlemen, I hope you've enjoyed it too. So again, Kiki Bright, thank you for being here, and folks, we'll see you next time on Reference Point.
Thank you.